again. So I have just discussed a topic of how I became a nurse here in Australia. So please watch the previous video if you're interested. I also touch base of the salary per state and the salary of a novice nurse, so which is a beginner nurse. Now this will be more specific because I will talk about the RN rates per year level and per state. I'm Jackie, a nurse by trade for about 16 years, and we'll talk more about this topic after the intro. Stay tuned.
Hi guys, I'm Jackie and welcome to my YouTube channel. Before we get started, please don't forget to hit subscribe button and the bell button to get an update with new videos uploaded in my channel. And please like, comment and share.
You also discussed this incremental level, but just a quick one. So if you are a registered nurse, you're up to the level where every year your salary increases as well, and this is based on the years of experience. So the first year here, or the zero grade here, is the new grad nurses. So they are the ones who just recently got their licensure here in Australia, and they are considered as a novice. So they are always under the supervision or guidance of a registered nurse. So in here, we usually partnered with them, with the senior nurse and the new grad nurse, up to the point where they can get their own patient. Is this that it is for safety purposes as well? Because you understand that with the education here, it's a 3 years nursing. There's not much placement or experience that they got when they were still studying. Also have to take into the factor that the real scenario is different when they were still a student, so they need a guidance. Hence, they are a new grad. So they're actually a new grad program in every state. You can apply for that, and I think for a year, um, you have like a rotation as well, so that so that the nurses, this new grad, can figure out what specialty they feel like they are going. So for example, they have two choices, or maybe four, three choices. They could put in there what ward they want. For example, if they want to be in the pediatric ward or oncology, or if they want to specialize in theater, ICU, or emergency department, then they can put that as their choice. But doesn't necessarily that it can happen as well, that they can get that position or that specialty that they wanted. But still, at least they have the the exposure and the experience, and hopefully after the new grad program, their manager would be like really keen to adopt or to employ them into their ward because of their skills and their work ethics. So if you are a new grad, my advice is to be a really good nurse, and be kind to everyone, and make sure that you always look after the safety of your patient. Right, going back with South Australia, they have up to increment of year 10, and the maximum hours, that's an hours, is 16,074 hours. Because in here, you are basically working 38 hours per week, and you multiply that for a year of 52 weeks, then that would probably constitute around 1,786 hour per year, and thereafter you get that increment. All right, so each is year 1, year 2, year 3, year 4, they have a corresponding salary. So if you are keen to jump the queue and don't want to be just following the hourly increments per year, then my tip for you guys is, take an overtime, take a part-time or casual work elsewhere, because you can get hours included in your overall working experience, and hence you're jumping the queue. So you can actually contact the HR and put a filled out form with all the hours of experience and the name of the hospital where you work. You can actually ask for, I forgot the term, but like, here you go. That's the statement of service or your certificate of employment. So in my example, you'll see in your certificate of employment the start date and the end date, or if it's still ongoing, yes, you can ask for that anytime in your HR department. And then you will see there the total number of hours that you've worked as of the date that you requested for it. So you can use that when you want to ask the HR if they can bump your increment levels. And on the next video, I'll show you how you're gonna put that in a table or in a form, and you need to submit that to your HR. If you're planning to submit a statutory declaration of your increments, then you need to have this kind of form. Actually, just got it from my agency before they gave it to me, because essentially when you're going to another employer, you have to prove that you have that much number of hours and number of experience. So for them to be able to determine what level you are, you need to have to justify that you have earned these hours. So if you're going to do this statutory declaration and this form, you need to make sure that you have the statement of service, which I just explained from um, previously, with all this certificate and stating the number of hours that you have accumulated. So with the statutory declaration, you just put the name of your employer of the hospital or your hospital, and then the hours per week you work on that hospital. If you're working full time, yes, it's gonna be 38 hours. If you're working less or part time, then it's gonna be stipulated in your sorry, in your statement of service as well. If it's 20 hours per week or 24 hours per week, and then just put there the date you commence, and if you already resigned from that work, that would be under the C's. Then what title were you at the time when you were working? Either you're on an RN year 8, year 7, or year 5, or if you got promoted, then it's going to be a CNS level for my case. And then just put the total hours work in there. So if you don't have, for example, in your statement of service doesn't justify how many hours you work at the time, and since, for example, you're working on a full-time basis, you just have to calculate from the time that you commence. So for example, if it's January 7 no July the 1st 22nd out to the February the 10th of the 23, so you just calculated how many um, hours you have worked on that duration, and then from that you get the total hours. So for me, for example, that's 18,457 at the time when I did this statutory declaration. And then you see this one at the bottom, you say I make a solemn declaration, and it's like blah 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 blah. So you need to go to justice of peace and just bring all these documents to proof, and then they will get it signed for you. So usually there is a free one, so just go and google that, and then type in JP or justice of peace near me, and then you will see a list of people who are um, capable of doing your request. And sometimes you can find them in the library as well, and they have a schedule, and sometimes lawyer can do that as well. Some I think have fees, but I'd rather go to the one who's free to do it. All right. So just a practice, guys. So if I had a total work of 18,457 hours in the last 15 years, then what year level am I? Going back. So if you have guessed that I'm somewhere in between year 8 or year 10, then you are correct. So if I'm going to South Australia, I'll be on a year 10. And then if I'm going to New South Wales, even if I've earned so much years of experience, then I'm at the year 8 level. And then if I'm going to, for example, I'm here now in Northern Territory, I'll be in year 7. Alrighty, this is the exciting part. So in Australia, there are 7 states, and each state gives different award pay rates. As per the chart, you can see the highest pay can be found in Queensland, followed by Western Australia, then ACT. Well, surprisingly, Victoria, New South Wales, and Tasmania were paying the new grads or the new graduate, the novices, at the third bottom. So for me, I just moved from New South Wales to the Northern Territory, and I could pretty much say that there are more benefits in here, especially with sick leaves and annual leaves, which I will discuss as well on the next video. So stay tuned. So again, thank you guys for watching my video, and looking forward to see you next time. This is the exciting part. So if you've decided to go to a specific state already, and this is the example salary of nurses in the public hospital. Right, so I just did extensive research for that. This is valid and present salary of nurses as of 2023. With Queensland, if you decide to go there, you're going to earn $39 per hour as a new grad or on the first year, and then you'll be having a salary of $52 per hour once you reach the year 8. And then similarly, um, if you decide, oh, I don't want to go to Queensland anymore, I'll probably go to ACT. So the same salary would be just starting from that $37, and then you go your way up your way up to $49. And I'll just leave these guys for probably 30 seconds, so that you'll have a bit of idea or time to decide where are you going in the future. Take a screenshot if you want. Just remove my face. Thanks. By the way, guys, I'm in Northern Territory right now, but not on this salary because I've applied for this job and I opted to apply for a higher position. But mind you, when I've discussed before as well about the casual rate, penalty rate, and all, but because I'm a permanent full time and work on an 8 to 4:30 job, then I don't have a penalty rate. So it's still the same. It's up to your choice. If you work in a higher position, then that means you need to work in a job that is like an office job, and you will of course have the benefit of having a good family time as well. That's the good part of it. Have social life because you don't need to work on weekends, but the cause of that is that you don't get penalty rates. So similarly, some people who are who have been working for like 30 years or something, you would probably see them still staying at an RN year 8 level because they've been working on weekends, so been working on the penalty time as well. So they are probably earning more than me. Right, moving to the next slide, it will be all right. So this is the RN salary annually per state as of 2023. So what I just basically did is I multiplied the rate of a nurse per hour by 38 hours, which is what would a person do of working in a week, and then multiply that by 52 weeks. So that would give you a total result of those salary. All right. I'll give you a 30-second as well. If you want to take a screenshot of that, that's fine. And on the next video, I'll probably gonna make a video about the working rights as well. What are your benefits if you're working for in a full-time basis? What are your annual leaves? What are your sick leaves? Thank you for watching. See you. Bye.